Welcome to Senior Health Formula. We're here every day helping you take control of your health, especially after 60. If you're new here, hit that subscribe button and turn on notifications. Today's hot topic, literally, is night sweats. Why do you wake up soaked, uncomfortable, or even chilled to the bone after sleeping? It might seem like a harmless annoyance, but for seniors, it can be a sign of something deeper. What if those night sweats were actually your body's way of warning you about something much more serious? Let's break it all down. Let's start with your environment. Did you know your body naturally cools down at night to help you sleep? But if your environment fights that process, say, a room that's too warm, heavy pajamas, or blankets that could double as insulation, you'll start to sweat. Try switching to moisture-wicking sheets, breathable pajamas, and keeping your room around 65 degrees Fahrenheit. A fan or cracked window might just do the trick. But if you've already tried that and you're still waking up drenched, then it's time to look deeper. Anxiety and stress don't clock out when you go to bed. If your brain is spinning with worry about your health, your family, or the world, your body may respond with racing thoughts, increased heart rate, and sweating. Nightmares and even night terrors aren't just for kids. If you wake up startled, scared, and sweaty, your nervous system could be firing off during sleep. Consider journaling before bed, mindfulness exercises, or speaking to your doctor if stress is keeping you up, or soaking your sheets. Now let's talk about hormones. You might think you left hot flashes behind with menopause, but hormone fluctuations don't always follow a calendar. Even years later, hormonal shifts can sneak up and disrupt your sleep. Hormonal disorders like hyperthyroidism, where your thyroid is working too hard, can also cause excessive sweating. You might also feel restless, lose weight, or have tremors. If any of that sounds familiar, bring it up at your next doctor's appointment. Now let's talk about something we all enjoy now and then. Food and drink. Alcohol, caffeine, and spicy food can all raise your body temperature and trigger night sweats. Some people notice they sweat more after drinking alcohol, especially at night. It widens blood vessels, messes with body temperature, and can worsen snoring or sleep apnea symptoms. And don't forget about medications. Some of the most common prescriptions and supplements can cause night sweats: antidepressants, blood pressure drugs, steroids, hormone therapies, and even niacin. Not sure if your medication is the cause? Ask your pharmacist or doctor to take a look. Now here's one you might not expect. GERD, also known as acid reflux. If you wake up coughing or with a sour taste in your mouth and you're also sweating, GERD could be the reason. GERD happens when stomach acid backs up into your throat, especially when you lie flat. Sweating may happen alongside heartburn, nausea, or a hoarse voice. Elevate your head while sleeping and avoid eating late at night. Your doctor may also recommend medications to control acid. Next up, hyperhidrosis. This is a condition where you sweat excessively, not just when it's hot. It can affect specific parts of the body or be more general, and it can happen during sleep. It's often genetic but can also be triggered by health conditions or anxiety. If you're constantly drenched and it's interfering with your life, ask about treatment options. Another big cause of night sweats is sleep apnea. This condition causes your breathing to stop and start during sleep, sometimes dozens or even hundreds of times per night. Each time your breathing stops, your body works harder to breathe again, which causes stress and sweat. You might also wake up with a dry mouth, headache, or feel extremely tired during the day. And if your partner says you snore or gasp for air, get checked out. Sleep apnea increases your risk for heart disease, stroke, and even accidents due to drowsiness. The good news? It's treatable, often with a CPAP machine that keeps your airway open and your night sweat under control. Let's talk infections. Your body fights infection with a fever, and sweating is your body's way of trying to cool down. Serious infections like tuberculosis, HIV, or bacterial illnesses can cause night sweats, especially if you also have chills, fatigue, or unexplained weight loss. Don't ignore these symptoms. See your provider if you think something more serious is going on. Now let's get into autoimmune disorders. These are conditions where your immune system attacks your own body. Some of them, like rheumatoid arthritis, Graves' disease, or sarcoidosis, can cause night sweats. You may also notice joint pain, muscle aches, inflammation, or flares of symptoms that come and go. If that sounds like you, it's time for a full evaluation. Here's something you may not know. Night sweats can sometimes signal a heart problem. Women especially may experience symptoms of a heart attack differently: sweating, nausea, fatigue, or pain in the jaw or back instead of the chest. If your night sweats are sudden, severe, or come with other odd symptoms, don't wait. Get checked immediately. Now let's talk about cancer. While most night sweats are not cancer, some types, especially lymphoma, can cause intense, drenching sweats at night. Other signs might include unexplained weight loss, fatigue, or swollen lymph nodes in the neck or armpits. If you're experiencing a combination of these symptoms, it's important to get a medical evaluation quickly. What else could be the cause? Diabetes can lead to night sweats, especially if your blood sugar drops too low while you're sleeping. Neurological conditions like Parkinson's or even past strokes can also interfere with the part of your brain that controls temperature. Even rare conditions like hyperparathyroidism or adrenal tumors can play a role. If your doctor has ruled out common causes, they may look into these less typical ones. So what can you do right now to sleep cooler and more comfortably? Keep your bedroom cool, around 60 to 67 degrees Fahrenheit. Use breathable bedding and wear light sleepwear or none at all. Avoid alcohol, caffeine, and spicy food before bed. Keep a glass of cold water nearby and stay hydrated. Maintain a healthy weight, avoid smoking, and exercise during the day, but not too close to bedtime. Finally, when should you see a doctor? If your night sweats are frequent or extreme, disrupting your sleep, unexplained, accompanied by other symptoms, or lasting more than a few weeks, then it's time to get help. You might need blood tests, sleep studies, or other evaluations to find the root cause. Remember, sometimes night sweats are no big deal, but other times they're your body waving a red flag. Listen to it. Thanks for watching Senior Health Formula. If this video helped you, give it a like, subscribe, and share it with someone who might need to hear this today. Until next time, stay cool, stay healthy, and sleep well.